My name is Jordan Gary, and this is my presentation on the obsessive-compulsive personality disorder. Mental disorders are a condition that affects the way people feel, think, and their ability to function. Many people throughout the world have a mental disorder. 1 in every 5 adults has a mental illness, and 1 in every 20 has a severe condition. The founding of OCPD can be linked to the teachings and theories of Sigmund Freud. He studied the unconscious and believed that the physical problems were linked to psychological processes and were not caused by the person's conscious. OCD is an anxiety disorder. It often becomes chronic, while OCPD is characterized by a lifelong pattern of excessive attention to detail, rigidity, and clinical perfectionism. OCPD and OCD have many characteristics that are similar in nature. Symptoms related to OCPD often develop in early adulthood, while OCD becomes recognizable in childhood. One of the main differences between OCPD and OCD is that people with OCD have unwanted thoughts, while people with OCPD believe their thoughts are correct. And that is according to the OCPD Medline Plus Medical Encyclopedia, which basically means that someone with OCPD believes what they are doing is the right way, while someone with OCD knows that what they are doing is not considered normal. The characteristics of OCPD are symptoms of perfectionism, which meant that everything needs to be in a specific order, following certain guidelines or anything that the person believes is right. Other common characteristics include lack of flexibility, over-devotion to work, refusal to give responsibilities to others, strict routines, and according to Barbara Van Noppen, it also means the rigid adherence to rules and regulations, an overwhelming need for order, and a sense of righteousness about the way things should be done. Now, when someone interrupts the routine of a person with OCPD, it makes them feel extremely upset, uncomfortable, and even angry. The character traits common with OCPD are related to early conflicts with parental figures, according to the OCPD historical and theoretical perspective. There is also a difference between obsessions and compulsions. An obsession is a recurring constant thought, while a compulsion is the action. OCPD is seen and diagnosed in about 1 out of 100 people, while many people have numerous symptoms but are never been diagnosed. When diagnosing a person with a mental disorder, they must meet every criteria located in the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders, which causes the diagnosing process to take a long time. Doctors will perform a physical exam and lab test to rule out any medical complications that could cause the issue. One of the first things doctors will most likely check is drug and alcohol abuse history. Next, if there's no medical complications found, the patient will be referred to a psychiatrist or therapist. Because of the diverse amount of symptoms, treatment is difficult. Each patient gets a specific plan designed to them. Unfortunately, there are a few large-scale studies for people with OCPD, which also makes treatment difficult. Medicines such as antidepressants or selective serotonin reuptake inhibitor can be given. However, the use of medicines to help treat OCPD is not recommended for a long-time use. One of the main points that a psychiatrist focuses on for treatment is counseling and medications. The psychiatrist will ask questions about symptoms, thoughts, feelings, and behavioral patterns. Psychiatrists look for patients' background to see if they're under any risk factors, which include someone who has family history of OCPD or OCD, or someone who comes from harsh discipline. OCPD is most commonly found in someone who is male or the oldest child. One of the most popular types of treatment is the cognitive behavioral therapy, CBT. The purpose of CBT is to help people with OCPD learn to control their disorder and help them live a normal life. During the treatment, the patient's psychiatrist discusses their issues that they might have that could stem from the disorder. In many occasions, a mental health counselor may encourage you to put less emphasis on work and more emphasis on recreation, family, and other interpersonal relationships. And in conclusion, there are many symptoms and complications that come along with any mental health disorder. There is no prevention of this disorder or any other mental illness. Treatments available can only suppress the thoughts and feelings with someone with OCPD. It's often confused with obsessive-compulsive disorder, so it leads to a lot of confusion within the community. And many people go about their lives without the knowledge that they even have OCPD, simply because a common symptom is that they believe nothing is wrong or abnormal with them. Obsessive personality disorders are one of the most prevalent personality disorders, occurring in almost 2% of the adult population. Alright, and that's it. Thank you.